Hello everyone, welcome to Heal Your Heart EECP Treatment Center. Today in this video, we are going to discuss about exercise and heart disease. Actually, exercise is one of the most important factor which preserve life itself. Unless exercise is done continuously, you are more prone to develop heart disease in the future. Now, how this lack of exercise is going to create heart disease? So before that, let me be very clear. Exercise can prevent heart disease, as well as if you have a heart disease and then also doing routine exercise will prevent the harmful effect of heart disease like getting a heart attack and death. So overall, if exercise is not done adequately, we are exposed to a lot of factors which is going to develop slowly, predisposing yourself into a heart patient. Now let us look at a couple of factors which will come to you if you don't do exercise. Number one is diabetes. Patients who don't do exercise tend to develop diabetes at the early age, as well as cholesterol level. Because you are not burning what you are eating adequately, your cholesterol levels start accumulating and you become hypercholesteremic. Otherwise, your bad cholesterol is going to be very high, like total cholesterol, your triglyceride level is going to be high. At the same time, your good cholesterol, HDL cholesterol will be low. And then eventually, because of lack of exercise, your blood pressure will slowly shoot up and you become hypertensive. And then the very important factor of exercise is obesity. So if you don't do exercise, then what will happen is the fat start accumulating in your lower abdominal area, which we call as a central obesity. Altogether, these are all called cardiometabolic syndrome. People who doesn't do regular exercise will predispose to these factors. And in fact, we all know, when I said about diabetes, hypertension, hypercholesteremia and obesity, these are all the precursor of heart disease. So lack of exercise will develop these risk factors, and these risk factors will help you to develop heart disease in later stage of. Now, how this heart disease is going to be averted if you do regular exercise? This is a very important question, because everybody knows if you do regular exercise, it will help you to prevent heart disease. But how does it act? So one of the important aspect of exercise, when you put yourself into an exertion, walking fast, brisk walking, playing or running, what will happen is all the metabolic demand in your body will increase. It means all the organs require more blood supply and more nutrition. To do that, the heart has to pump harder and has to pump faster. Now the only way the pump, which is situated in the center of the chest, is to able to give blood supply and nutrition to the all organs. This can be achieved only by two means. Either it has to go fast, that is why your heart rate or pulse rate increases, and second is the heart has to pump more volume of blood into the circulation. This is achieved by strong contraction of heart muscle. When this does, the pressure slightly shoots up. This is a reason exercise causes high blood pressure and also high pulse rate. So when this is done, what happened is the blood started flowing into the vascular system. The vascular system means the blood vessel which is connecting the heart to various organs. Throughout the body, the blood vessel was able to carry blood supply and nutrition to all the cells in nook and corner of your body. In fact, these blood vessels are, I would say, 1 lakh kilometers long. So much of blood vessel, the blood has to flow. So the heart has to pump harder and harder. Now, people who do exercise, what happens is the blood flow will start going with a higher velocity and force because it's contracting harder. Now, this is one of the very important fundamental principle of life itself. In fact, when the blood started flowing faster, this started pushing the blood across the blood vessel. It will be rubbing the vessel. So what happens is, inside the blood vessel there is a thin layer of cells which is called endothelial cells. This endothelial cell is a life giver. In fact, when it can able to sense that your blood is going faster, what the endothelial does is it releases lot of healthy hormones. It keeps your blood vessel healthy by dilating the vessel and keeping the vessel flexible. Now, As long as the endothelial function is going to respond to the exercise and keep your vessels healthy, it means flexible, you will not have heart disease or you will not get a heart attack and you can live longer. If the blood flow is not adequate or it is not flowing as fast as should be, if you are in a sedentary lifestyle, then what happens? This endothelial cell slowly get destroyed, and in fact slowly your vessel becomes stiffer and stiffer. So the life and death depends upon this exercise and endothelial function. If your vessels is not responding and it becomes stiffer because of lack of exercise, death naturally ensure or heart attack risk goes up. So by doing exercise, you keep this endothelial function alive and healthy, and you can able to prevent getting into heart disease in later stage of your life. ஒரு இருதய நோயாளிக்கு பைபாஸ் சர்ஜரி, ஆஞ்சியோபிளாஸ்டி சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. இதற்கான மாற்று சிகிச்சை முறை EECP, Enhanced External Counter Pulsation, Heal Your Heart, Vaso-Meditech EECP Treatment Center.